Okay, so good afternoon, everybody. Thank you so much for joining us today. My name is Deborah Niblick, and I'm the Senior Librarian at the Maury Park Bruggemeyer Library today. And we have Linda Williams from Consumer Action, who's going to give a presentation about Medicare and how to basically navigate various different options when applying for the program. So if you have any questions, please wait till the end of the program, or if you need to step away, that's okay. I'm recording this program, so you can view it at a later date, which I'd be happy to email to you. And again, any questions, you should be able to have the chat option. If not, I'm pretty sure you do. I'm going to make sure of that. And I'm going to go ahead and hand it off to Linda. So thank you so much.
Hello, good afternoon. Thank you so much for joining us today. Thank you for taking time away from Meet the Press, NFL, start of the football season, or your favorite Sunday program to join us today. As Deborah mentioned, my name is Linda Williams. I'm a Community Outreach and Training Manager with Consumer Action. And before we get started, just want to go over a couple of housekeeping tips. The session is being recorded, and I believe the library will post a link to the recording on the library's website. And Deborah, if you have a question, please use the chat function. Deborah will be monitoring the questions, and she will present them to me at the end of the training. Before we get started, I would like to tell you a little bit about Consumer Action for those of you who are not familiar with us. We are a national nonprofit. We've been serving consumers since 1971. At Consumer Action, we enjoy a national reputation for creating multilingual consumer education materials in the field of credit, banking, privacy, insurance, and utilities. All of those kitchen table, pocketbook, budgeting issues that impact you, your families, and communities that you live in. When the housing market began its decline in 2006, we were right out front. We launched our Housing Information Project to help consumers learn how to keep their homes, protect their property investment, and avoid foreclosure. We are a 501c3 organization. So let me get started into the program. So some of the things that I'm going to discuss within this next 60 minutes would be the changes coming to Medicare in 2021, how Medicare works, types of Medicare plans and costs, Medicare eligibility, how you can protect your Medicare account, because there are so many frauds out there that's attacking Medicare. And I'm going to go over some assistance and some resources. So starting with navigating your option, I'm going to start off by talking about the changes that's coming to Medicare in 2021. As always with Medicare, you want to know October, sometime in October, the changes that are coming to Medicare in the event that you need to change your plan. So as always, the new year brings essential dates that you need to know and keep up with. For an example, if you are already receiving Medicare, but you're not happy and you're thinking about changing your plan, the next annual enrollment period will begin in less than a month on October the 15th, and it would run through December the 7th. Now, during the Medicare annual enrollment period, this is the time when you will switch from, if you're in a Medicare Advantage plan and you're not happy, you want to switch back to original Medicare. If you're receiving original Medicare, this is the time you want to disenroll from original Medicare and enroll into Medicare Advantage plan. Or you may want to change from one Medicare Advantage plan to another, or you want to sign up for Part D prescription drug plan, or change your drug plan. Now, you may be saying, well, Linda, why would I want to change my plan? But there are several reasons why you may want to change your Medicare coverage during an annual enrollment period window. The most common reason, it could be an increase in your premiums going up, or your favorite doctor or specialist that you need is no longer in your plan's network, or your medication that you are on and you need to stay on, it's being taken off the covered list, meaning you're going to have to pay for that medication out of your pocket. And when you're looking to change plan, those are just a few things that you need to consider. Now, if you haven't already, if you are already receiving Medicare, if you haven't already, you should receive shortly, sometimes this month, an annual notice of change. You will receive this notice every September, so be on the lookout for it. So what do you do when you get this notice? Well, you don't throw it in the trash, and you don't put it on the coffee table or in the drawer with the other bills. What you want to do is you want to open it, review any changes that's going to come down for the next year to your plan. Any change to your plan, you want to make sure that you note those plans, and you want to ask yourself, can I live comfortably with this plan with these particular changes? If you don't get that document by October the 1st, it's very important that you contact your provider and ask for a copy of that notice. There are a couple of changes that you need to be aware of when you're reviewing that annual notice of change. Number one, the Trump administration's 2021 budget is expected to reduce Medicare spending. So you know what that means, right? One of the changes that Medicare patients will see in 2021 is they will be channeled to see nurse practitioners instead as their primary caregivers instead of the doctors they were seeing. Why? Because it's cheaper to see a nurse practitioner than it is to see a doctor. Also, the reimbursement rate to providers and doctors will also see a reduction. Now, this could lead to doctors exiting, getting out of the Medicare business altogether. Why? Because they're going to be receiving less money to take care of Medicare patients. In addition, while we're still not actually sure, it appears that the actual cost for Medicare B in 2021 will be around $150. Now, it's still too early to tell, but the early projections that are coming in from the Center for Medicare and Medicaid Services, it looks like it's going to be around $150, but we won't know for sure until the information is released in October. Now, there's another date that you need to be aware of, and this is the date for the special enrollment period for 5-star Medicare Advantage programs. And that date is December the 8th through November the 30th. So from November the 30th to December the 7th, you can't enroll in a 5-star Medicare program. The date that you can enroll in the 5-star Medicare program is from December the 8th through December the 8th, 2020 through November 30th, 2021. Now you may be saying, okay, so what is this 5-star rating? Medicare, they use information from members' satisfaction survey, from plans and healthcare providers to give an overall performance or star rating to their Medicare Advantage plans. So a Medicare Advantage plan can get a rating anywhere from 1, which is bad, to 5, which is excellent. For an example, Kaiser, I'm in Fontana. Kaiser in California, offers an HMO Medicare Advantage plan, and it enjoys a 5-star rating. Now, these ratings are supposed to help you compare and contrast plans by looking at the quality and the performance of each Medicare Advantage. But before you get too happy, 2 recent studies just recently were released to indicate that when it comes to Medicare Advantage, there's a lot of room for improvement, especially when it comes to customer satisfaction. So in effective 2023, Medicare and Medicaid services will be changing its rating system. So while you can look at the rating system to make an informed decision on which plan you should go for, just keep in mind that there are some problems with the rating. Now, if you are enrolling in Medicare for the first time and you're interested in enrolling in a Medicare Advantage plan, then you want to start to do your research on the best plan for you now. Why? Because open enrollment begins on January the 1st, and it ends in March. And if you're thinking about enrolling in an Advantage plan, there's a certain changes that are coming to that program in 2021 you need to be aware of. One of the biggest changes coming to the Medicare Advantage plan is the expansion of telehealth services. Yeah. Telehealth services, what they are claiming, the reason they are moving to it is because it's going to allow seniors to video conference with their doctors from their home. You like me, I want to see my doctor, not over the computer, but I want to be in the office so they can check my heart and my blood pressure and everything else. But in the COVID-19 era, what you're seeing is that this allows seniors to teleconference with their doctors, and it'll allow seniors who are high risk to limit their exposure to the coronavirus. So the Center for Medicare and Medicaid Services are giving Medicare Advantage plans the flexibility to include in telehealth practice areas including primary care, cardiology, dermatology, psychiatry, gynecology, which I don't see how they're going to do that, but gynecology is going to be part of the practice areas that will be included in telehealth. Now, I think it's going to be up to the particular plan that you enroll in, which services they're going to include, but Medicare allows them the option to include primary care, cardiology, dermatology, psychiatry, and gynecology into their telehealth program. Another change that's coming to Medicare Advantage is long-term care. Now, you need to understand that Medicare does not pay for long-term care at all. You need private insurance for that. But what's being allowed, Medicare Advantage will be allowed to cover certain assisted living expenses. And the whole point of it is, the goal of it is to allow the beneficiary to continue living independently at home versus transitioning into a full-time living facility or a nursing home. These changes are not mandatory. It's going to be up to the particular Medicare Advantage carrier if they want to include these supplemental home services as part of their plan. So some of the services can include adult daycare services, meaning that your Medicare Advantage plan will contract with, I guess, certain adult daycare centers where you can go, in-home personal care, like giving you baths and combing your hair, fixing you certain meals. It will also allow monthly or quarterly allowance for over-the-counter medications for allergies, cold, supplements like vitamins and Tylenol PM or some type of pain reliever. It will also include home safety modifications like grab bars, and also meal delivery, including grocery delivery services, transportation services through Lyft and Uber. Now, again, I want to stress that these changes are not mandatory. It will be up to the Advantage carrier to decide whether or not they're going to include those services. So if you are new to Medicare and you're thinking about a Medicare Advantage plan, then maybe one of the things that you want to do your research on before you select a plan. Another important change is an option for people with end-stage renal disease. So due to the changes implemented by the 21st Century Cures Act, seniors with end-stage renal disease can now enroll in Medicare Advantage plans starting on January 2021. This will allow those patients to have more coverage options with Medicare. Now, there's some pros and some cons to these new changes for the beneficiary as well as caregivers that you should be aware of. For one, the Medicare Advantage plan will limit the out-of-pocket expenses for the patient with the end-stage renal disease, cost to $6,700 a year. So with Medicare Advantage, their out-of-pocket expenses, their out-of-pocket costs will be limited to $6,700 per year. In contrast, if that individual was enrolled in the original Medicare, and with the original Medicare, I mean A and B, their out-of-pocket costs could be up to $15,000 a year. So there is a benefit to going to Medicare Advantage. But there's a negative side. The negative side is If a patient with end-stage renal disease is living in an area where there are a high number of those patients, they could easily face a reduction in healthcare benefits due to the complex and costs associated with having end-stage renal disease. There may be some more changes coming to Medicare. Like I said, those changes should come down sometime in October, towards the middle of October. So you want to keep your eye out for those particular changes. Let's talk a little bit about the 4 parts of Medicare, how Medicare works. Medicare, again, is a federal health insurance program, which is the primary source of medical coverage for adults 65 years or older. It is also the primary care for a lot of individuals with certain disabilities, such as end-stage renal disease or Lou Gehrig's disease. Now, the Social Security Administration, they enroll all Medicare beneficiaries into the Medicare program, and they collect the premiums. The Social Security Administration is also coordinate with different states, a Medicaid program, or in California, our Medigap program. And if you are low income and the state is paying for your premiums and your co-insurance, they will collect that payment for the state. For an example, in California, if you live in California, Medicare premiums are for Part A and Part B are paid for Medicare recipients who qualify for Medicare. Now, let's take a look at the intersection between the relationship between Social Security and Medicare. Now, consumers can start receiving Social Security or survivor's benefits as early as 62 if you are a retiree. So if you are retiring at age 62, you can start receiving your Social Security benefits. If you are a survivor, meaning that you were married to someone who was entitled to Social Security benefits, you were entitled to receive those benefits at age 80. However, in order to get these Social Security benefits, a worker must have 10 years of credit for retirement benefits. For a survivor, the person that's deceased can have 10 years of credit, but it also depends on the age of the person at the time that they pass away. Now, most consumers are generally eligible for Social Security and Medicare at the same time. However, if you decide to retire at age 62, you may be able to get Social Security, but you will not qualify for Medicare. And that's the same if you are a survivor. You can get those survivor benefits at age 60, but you cannot qualify for Medicare until you reach the age of 65. Now, there's another benefits program that's administered by the Social Security Administration, and it is called the Social Security Disability Insurance, or SSDI. More than 80 million people under the age of 65 receive SSDI because of their health conditions prevent them from working. So in order to get SSDI, you must have a disabling condition that will not allow you to work. Now, those individuals are eligible for Medicare, but only after a 24-month qualifying period. So the first 24 months that they are disabled, they may be able to get the SSDI, but they will not be eligible for Medicare. So they would have to qualify for Medi-Cal, or they may be able to qualify if they became disabled and had to stop work. They may be able to continue getting their employer's insurance, but they cannot get Medicaid they have a 24-month waiting period. There are a couple of exceptions, and those exceptions, if you're diagnosed with Lou Gehrig's disease, or if you have end-stage renal disease, then you will be able to qualify for the Medicare. Another program that's administered by the Social Security Administration is SSI, Supplemental Security Income. Now, nearly 1.28 million people in California rely on SSI benefits. Over 570,000 of those individuals are seniors, and 110 children. And that's because they have significant disabilities that allow them to qualify for this benefits. Now, in California, SSI recipients receive the federal benefit and also a state supplement. So in 2018, when you join the federal benefit and the state supplementary benefits, these individuals were receiving like $910 a month. Now, they may get this benefit from the Social Security Administration, but they will not qualify for Medicare until they are 65 years old. They would have to get Medicaid. So let's take a look at a few examples to understand what I'm saying. James applies and is receiving Social Security spousal benefit at age 62. This is the survival benefits from a spouse. James will not be eligible to receive Medicare until he's 65 years old. Martha became disabled at 50, and she applied for Social Security disability benefits. If approved for SSDI, Medicare eligibility for Martha will not start until 24 months after the date she became disabled. Shelley, age 50, received SSI based on her disability. Shelley would qualify for Medicare, but only when she turns 65 years old. Okay, so what do parts A and B cover? Well, Medicare Part A is commonly known as your hospital insurance. It pays for a stay in a hospital or a skilled nursing facilities and certain expenses of home health care. This is your original Medicare. Now, in order to medically necessary hospital stay under Medicare will include a semi-private room, meals, prescription drugs, and other treatment, as well as support from nursing and staff. Now, in order for your Part A coverage to trigger, your doctor must affirm that you need at least a 2-day hospital stay. Now, you can get your hospital stay as long as the doctor say this hospital stay is going to benefit you, that you are expected to improve. The long-term stays in hospitals or nursing homes are covered, and I'm going to discuss that a little bit later. The maximum amount that they are covered, because although you're in the hospital, you have a limited time period that you can stay in the hospital. Now, in addition to Part A pays expenses for hospice care provided you're terminally ill. Now, there are a couple of scams that are going around where some doctors are putting seniors in hospice care, and they are collecting this money. They're billing Medicare for hospice care, and this person is not terminal. Hospice care is something that you get one time in your life. So if you're not terminal and they said they're going to put you on hospice care, you say, well, wait a minute, I don't need hospice care, because you're going to only get it one time in your life. And once that they bill and they've gotten their money, you won't be able to receive it again. Now, your Medicare Part B insurance covers services such as outpatient care, mental health care, the lab tests, your doctor's visits, your durable medical equipment, for an example, a walker, a wheelchair, oxygen tank, a portable potty. Those are some of the durable equipments that's covered under Medicare Part B. Medicare Part B also covers certain preventative procedures such as bone mass measuring test every 24 months, your mammogram every 12 months, cardiovascular disease screening every 2 years. Your flu shot is free once a year. Also, Medicare pays for COVID testing and tracing, and it's free. I don't care what part of Medicare you have, there is no out-of-pocket expense for you for COVID testing or tracing. It's all free. So on the screen, you could take a look at what Medicare Part B covers. Medicare A covers, as I said, your hospital care, your skilled nursing facility. That could be a nursing home, but it would have to be a skilled nursing facility care, short-term nursing home care, home health care services, and hospice care. Part B, you get your welcome medical exam. It's a prevention visit once you enroll into Medicare. And you have your annual wellness visit every 12 months. And every 12 months, they're going to want to do lab tests and blood work and x-rays. That's covered. Again, your medical equipment, your wheelchair, your hospital bed, your mental health care, and ambulance services is covered. One thing about ambulance service, Medicare is always slow to pay that. And the ambulance service will be billing you, billing you, billing you. So you just have to be patient and let Medicare take care of that. What parts of Medicare A and B do not cover? They do not cover annual physical exams except for the one-time welcome Medicare exam when you join Medicare, and then your annual wellness visit every 12 months. There's a difference. Long-term nursing care for more than 100 days, they will not cover. Acupuncture, they will not cover. Routine foot care, they will not cover. Cosmetic surgery, they will not cover. Get the facelift before you go on Medicare. Hearing aids, dental care, and dentures, they will not cover. If you get sick outside of the United States, you are not covered. Okay. So let's take a look at the cost of Part A. Most people, most consumers don't pay a monthly premium for Part A. In fact, 99% of Medicare beneficiaries do not pay Part A. And why? It's because if you've worked a certain number of months, your Part A is already free to you. When it comes to Part B, we do pay a percentage for your Part B. Excuse me, I lost my. You pay a percentage for your Part B. But back to your Part A. If you pay Medicare taxes for less than 30 quarters, the standard Part A premium that you would pay in 2020 is $458. Now that amount will go up in 2021. If you paid Medicare taxes for 30 to 39 months, then your standard Part A premium you would pay in 2020 is $252. But that amount will more than likely go up in 2021. Now, regardless to whether you pay a premium or not, you will still have to pay a deductible and co-payment if you use your Part A coverage during a given year. For an example, in 2019, Medicare beneficiaries were responsible for the first $1,364 of their Part A expenses as a deductible before Medicare would make any payments on their behalf. Now, in most cases, if you have Part A, you'll also have Part B. The standard monthly premium from Part B in 2020 is $144.60, which is an increase of $9.10. From the $135.50 that beneficiaries had to pay in 2019. This year, Social Security beneficiaries received a cost of living, what they call a COLA adjustment of 1.6%, which generally increased the average benefit by $24 a month. I remember my mom used to love to get these cost of living. She was like, oh, we're getting the increase. Oh, we're getting the increase. And the way that she would sing about it, you would think she was getting $100 to $200. And I would look and I said, Mom, all you're getting is $24. But to her, that was a lot. So, but it's not likely that you're going to get a cost of living adjustment in 2021. All signs point to recipients not receiving one, especially with the, because one of the things that the Trump administration is doing is they're moving funds away. So they are cutting funds to different programs like FEMA. They move funds away from FEMA and they are trying to cut the cost of Medicare as well. Now, if you are what the Social Security Administration deem a high earner, you will pay more than $144.60 for your Part B premium. Why? Higher earners are subject to what's called income-related monthly adjustment amounts, or IRMAA. This is the amount that you pay in addition to your Part B medical insurance or your Part D prescription drug plan. The income-related amount is based upon your modified adjusted gross income reported on your taxes 2 years prior to you being charged this adjustment. Let's take a look at an example to give you a better idea of what I'm talking about. If you take a look at the screen, in 2019, the IRMAA for Medicare Part B and Part D was based on tax returns that were filed in 2017. So if you look at the base for individuals, if individuals that made less than 85,000, they filed a joint return and they earned less than 170,000, or they were married and filed a separate return and they made less than 85,000. When they Part B IRMAA, they Part B didn't change. It was 135.50. The Part D for their drugs was $32.50. So the total amount they paid was $168, which was the baseline, which just about every recipient paid during that time period. But if you go down to number one, if the individuals that made above 85,000 but less than 107,000 and they filed the individual return, or they filed a joint return and they were above 170,000 up to 214, you look at the Part B IRMAA, they had to pay $189.60 for Part B, and they had to pay an $44.90 for their Part D, a total of $234.50. Now, if your income in 2008 was 87,000 or less, that base, or 147,000 or less that you filed a joint tax return, then your Part B premium in 2020 was $144.60. That's what everyone had to pay. However, if you earn more than 187,000 but less than 109 and you filed the individual tax return, or if you filed a joint tax return and you earn above 174 but less than 218, and you filed joint taxes in 2018, your monthly Part B premium for 2020 was $202.40. So what happens? What happens is if you your income dropped after 2018 after you filed your tax returns, and now you are stuck with this higher amount. Is there an appeals process? Yes, there's an appeals process. If your financial situation changed since you filed your tax return, remember it's based on a tax return 2 years prior. So if your income has dropped during this time, you are eligible to file an appeal. You can file an appeal if you got married or divorced, you experienced the death of a spouse, you lost your job, or you lost a major source of income or income producing property, or if you think the Social Security Administration just got the wrong taxpayer and they're charging you something for somebody that, and it's not you, which happens. So in addition to the premiums that you would have to pay if you have to make a Part A, if you have to pay for your Part A, as I stated earlier, you also have to pay a deductible and a copay. The Medicare Part A inpatient deductible that you would have to pay when admitted to the hospital is $1,408, which is an increase of $44 from 2019. This deductible covers your share of costs for the first 60 days of a Medicare covered inpatient hospital visit during a benefit period. So for the first 60 days that you are hospitalized, you would have to pay $1,408. This year, your co-insurance amount is $352 per day, beginning the 61st day through the 90th day that you're in the hospital in a benefit period, and $704 per day for lifetime reserve days. Now, lifetime reserve days are additional days that Medicare would pay if you are hospitalized, but they are lifetime benefits, meaning you only get these reserve days once in a lifetime. And the Part A would pay if you're hospitalized for more than 90 days during a benefit period. And for individuals in skilled nursing facilities, the daily coinsurance for day 21 through 100 days of extended care is $176 per day. So if you are put in a nursing home and you're there for 22 days, starting on the 22nd day through 100 days of extended care, you will be responsible for $176 a day. So what is a Medicare benefit period? Your benefit period begins the very day you enter a hospital for care or a skilled nursing facility for care. The benefit period ends when 60 days have passed since you've received the hospital care. So you go into the hospital on December 1st and you stay until December 10th. Okay. When you go in on December the 1st, that's when your benefit period starts. The benefit period ends when 60 days have passed since you've received either hospital care or skilled nursing care. So if you went on December the 10th, December the 1st, and you got on December the 10th, January 10th, February 10th, that will end your benefit period. The annual deductible for Medicare Part B is $198, which is an increase of $13 since last year. As I stated, the original Medicare Part A and Part B, they cover, Medicare Part A and B cover a lot of different medical related expenses, but it does not cover everything. As a result, many low-income consumers with Medicare, they are often enrolled into the state's Medicaid program to cover these costs. Others are enrolled into programs like Medicare Advantage or Medigap to cover the costs that Medicare does not cover. You probably heard that Medicare is going to, if you have the original Medicare, it's only going to cover 80% of items that are Medicare related. There are some services that you may receive that Medicare is not going to pay anything on. But the Medicare related expenses, Medicare will only pay 80%, and which means you are responsible for 20%. And that 20% can be very, very high. So what do consumers do? Low-income consumers, as I said, they enroll into Medicaid, which in California is Medi-Cal, or they enroll into programs like Medicare Advantage and Medigap, which I'm gonna cover a little later. Let's first take a quick look at how the state's Medicaid program works with Medicare. Consumers who have both Medicare and Medicaid are considered to have dual eligibility. All states offer a different variety of Medicaid programs with eligibility and coverage that varies from state to state. If you qualify for a Medicaid program, that Medicaid program is going to help you cover the cost of the services that Medicare don't cover. For an example, Medicaid will act as your secondary insurance. Medicaid can provide premium assistance. That is that monthly payment that you make to Medicare A if you didn't have enough years worked and you have to pay for your part insurance, or that $144 you have to pay for Medicare each month is generally taken out of your Social Security check. So Medicaid can provide premium assistance. Medicaid can also provide prescription drug assistance. For an example, in California, Medicare is required to pay the Part D premiums for all eligible Medi-Cal members, and they also pay for the Part A premium if you have to pay, and your Part B coverage. So let's take a quick look at Medicare Advantage. Medicare Advantage is what you see on the screen. Medicare Advantage is your Part C. Part C is your Medicare Advantage plans. Medicare Advantage plan is an alternative way for you to get your original Medicare. Medicare Advantage plans, they are sponsored by Medicare, but Medicare pays private insurance companies to provide the healthcare services to beneficiaries enrolling in a plan. For an example, I have Medicare Advantage through Kaiser. I have to continue paying my Part B premium, which I pay every month out of pocket because I'm not getting Social Security, which I explain that to you a little later. But as soon as I start receiving Social Security, then my Part B premium will come out of my Social Security benefits. So if you enroll in Medicare Advantage, in order to enroll in Medicare Advantage, you must be enrolled in Medicare Part A and Medicare Part B, and you must continue paying your Medicare Part B premium. Either it's coming out of your Social Security check or you are paying it out of pocket. If you join a Medicare Advantage plan, you are still on Medicare. You still have all the rights, all the protections that are entitled to all Medicare beneficiaries. But you receive all of your Medicare covered benefits through a private Advantage plan like Kaiser. Now, there are some Medicare Advantage plans that offer Medicare prescription drug coverage, but there are others that do not. So when you're searching for your plan, if you want to have everything in one spot, your medical services and your prescription drug in one plan, you want to make sure that that plan that you select offer you those choices. If you join a Medicare only plan, you may not be able to join a separate plan in order to get your Part D prescription. So it's going to depend on what type of plan that you join. There are several different types of Medicare Advantage plans. There's the Health Maintenance Plan, the HMO, which is what Kaiser is. There are Preferred Provider Organization, PPOs. There are also private fee services plans, but we don't have any in California, so I'm not going to discuss that. And there's also special needs plans, which we do have in California. So if you enroll into a Medicare HMO plan like Kaiser, you are required to use only the doctors and the facilities that are contracted with that particular plan. So you are only allowed to go to doctors at Kaiser. You will have your primary care doctor who will manage your health needs. And before you can see a specialist in your HMO network, you would have to get a referral from your primary doctor, except for OBGYN. There is a requirement to there is a requirement that you can waive that for emergency services. Let's say you live, the nearest hospital to you is 10 miles away and you have an emergency and you call an ambulance. The ambulance is going to take you to the nearest emergency hospital. But because you have an emergency, then whatever the cost is, Kaiser will waive it because it was an emergency. So it was an urgent care, the reason that you had to go outside of your network. Now, if your current doctors are not under contract with your HMO that you select, and you want to go to that doctor outside of that network, then you would have to pay out of pocket for that cost. Medicare, not your HMO plan, is going to pay for that cost. Now, some HMO do offer what they call point of service options. And so when you're looking for a plan, you want to ask that question: do you have point of service options? Your point of service options are going to allow you to see a doctor outside of the plan's network. But here's the deal: they may allow you to see a doctor outside of that network, but it's going to cost you more. Your share of cost is going to be more than if you'd have stayed inside the network. Now, some HMOs also offer Medicare prescription drug coverage and others do not. If you're in an HMO plan that does not offer the Part D coverage, again, you generally cannot go outside to get that coverage. So you want to make sure you're covered for, if you get this Medicare Advantage plan, you want to make sure you get one that offers the Part D prescription, because you may not be able to go outside to get it. HMOs are one of the most popular type of plans, and HMO Advantage plans are one of the most popular plans available in California. In 2019, only 49 out of 58 counties in California had at least one HMO plan. Now, when it comes to the preferred networks, like your PPOs, like Medicare HMOs, they have networks of providers. And again, you need to see the provider in your network, because when you do, you pay a lower co-payment than you do when you go outside. Now, the PPOs are also popular, but they are, in 2019, there were only 7 counties in California that offered these plans, especially these plans with drug coverage. Now, the last thing that I want to talk to you about in this area is what they call a special needs plan. So the Medicare Special Needs Plan are only designed for certain populations. These include people with chronic or disabling conditions and people who are eligible for Medicare and Medigap, dual eligibility. Or people in certain institutions like nursing homes. Because if you remember, I said after you stayed in a nursing home for so long, you had to pay a certain amount. Well, for individuals in nursing home, they could be, if they meet the special needs requirement, then the state will come in and pick up the tab for the cost of their care. Now, Medicare Part D is your prescription drug plan. Everyone, when Medicare has to make a decision about their prescription drug plan. And there are two types of plans. You can get the standalone prescription drug plan, and you could get the Medicare Advantage drug plan. If you enroll in the original, what they call fee-for-service Medicare, so if you hear fee-for-service Medicare, they're talking about the original Medicare, not Medicare Advantage and not Medigap. If you can enroll into a standalone prescription drug plan. These plans can provide prescription drug coverage for you. In California, there are at least 32 standalone prescription drug program, and the monthly premiums can range anywhere from $12.80 to $118. So that's one of the things you want to take in consideration when you are making your decision. The insurance companies that sponsor these plans, they set these premiums way in advance and has nothing to do with your health condition. It has nothing to do with the medicine that you take. These premiums are already just set in advance. So if you enroll in or you want to join a Medicare Advantage plan with a prescription drug coverage, you want to make sure that you get your Part D coverage through that particular plan. So let's move on to Medigap. Medigap is a it's a supplemental plan. It's a supplemental health insurance plan you purchase through private companies. This insurance, it pays for all or part of the coverage that are not fully covered by your Medicare Part A and Part B, such as your co-insurance, your co-payments, your deductibles, and your medical bills when you're traveling internationally. So Medicare Gap is one of those services that will cover you if you travel out of the country and you become ill. You can use that service while you're traveling. Now, beginning beginning this year, you can no longer get a Medigap program that will cover your co-insurance, your co-payment, and your deductible. And I think that was Plan F. Congress decided that if you're receiving Medicare, you need to pay something, and that they were you become lazy if you had an insurance that paid everything. So they had a plan called F. See, Medigap plans are lettered. They are G, K, or L. They had an F plan. This F plan was the Cadillac plan. It paid everything, but new enrollees cannot get into this plan. For those that are already in it, they can keep F, but new enrollees trying to get in cannot get into the plan. So Medigap, one of the things that Medicare Advantage, certain Medicare Advantage plans will pay for dental, vision, hearing aids, and also for you to go to the gym. Medigap doesn't pay for any services that are not covered by original Medicare. So you won't be able to get vision care. You will not be able to get dental care, hearing aid, or prescription care with Medigap. If you want Medigap for your provider, then you would have to purchase a drug prescription plan. If you are Medicare supplemental plans, again, are categorized by the letters. The plan with the letters actually identify what type of benefits you are offered through that plan. there's another thing that you need to know about the California Medicare plan birthday rule, which I really, really love this particular rule, which it starts 30 days before your birthday and it ends 30 days after your birthday. One of the things that you need to know about Medigap is this is insurance that's purchased off the market, which means that if you purchase the insurance during this gap period, 30 days before your birthday, up until 30 days after your birthday, then if you have any type of pre-existing condition or anything like that, you won't go to underwriting. So you won't have to worry about going to underwriting and being denied your services, because underwriting will not kick in. But if you buy it after that date, then you would have, or if you make changes to it, then you would have to go through the underwriting. You would have to go through the underwriting process that you really don't have to do. So during the window, you cannot be denied medical insurance for any type of health condition at all. The rule would give California Medicare beneficiaries an annual change. So say for an example, now I'm already receiving, I have Medicare Advantage. Let's say I want to change to Medigap because I want an insurance that's going to pay more of my co-insurance than my Medicare Advantage's plan. So my birthday starts on December 17th. So I have until November the 17th until January the 17th to make that annual change into Medigap. And when I make that change, if I have high blood pressure, if I have diabetes or anything like that, I will not have to worry about it because my policy will not go through underwriting. It will not go through underwriting at all. So what are some of the differences between Medigap and Medicare Advantage in the event that you want to take advantage of the two? Well, number one, original Medicare plus Medigap. Monthly premiums are not limited to your, you have to pay the monthly premiums, but it limits your out-of-pocket expense. With Medicare Advantage, you have low or no premiums. For an example, I live in San Bernardino County. So when it comes to extra payments for Medicare Advantage, I have no premiums for that. Yes, I have to pay I continue paying my Part B premium, but I do not pay a premium for the Medicare Advantage. I do have co-pays, I do have co-insurance, I do have deductible. For an example, if I go to get lab work at Kaiser, I have to pay a deductible, which is $35. With the Medigap, you have limited out-of-pocket expenses. You have the monthly premium, but you have limited out-of-pocket expenses. With the original Medicare and Medigap. So with Medigap, you have the original A and B, but in order to take over some of the costs like co-insurance and deductible, you buy Medigap, and Medigap covered those costs. But with original Medicare and Medigap, you have the freedom to choose providers. You have no network restrictions. With Medicare Advantage, you have network restrictions. With the original Medicare plus Medigap, referrals you don't need a referral to see a specialist. With Medicare Advantage, you need a referral to see a specialist. And you must see an in-network specialist. And it may take you months to get that referral to see that specialist or to get in to see that specialist. With the original Medicare plus Medigap, prescription drug coverage is not included. You would need to get a Part D standalone standalone prescription D coverage. With Medicare Advantage, most plans, not all, but most plans will include your prescription drug coverage. So when you are researching, trying to get that plan, if this is important to you, you want to make sure that the prescription drugs are covered. If you have expensive medical issues and if you have really expensive medical issues, then you will benefit from a Medigap policy because the co-insurance, the copay, and often the deductible are covered. Some routine services like vision, hearing, and dental are not covered. With Medicare Advantage, they could be covered, but you may have to pay extra per month. For an example, I pay Kaiser $20 every month for extra services like vision, hearing, fitness, and dental. And the last time I went to the dentist and I tried to use this service, I was denied. They wanted me to use my primary. So it's a secondary. It's only going to kick in if you have another dental coverage. It's only going to kick in if that dental coverage does not cover it. So I'm not sure if you don't have another dental service how it will work, but the last time I went to the dentist, I was denied. With original Medicare and Medigap, you have nationwide coverage, and with Medicare Advantage, you don't. You're only covered inside your service area unless there is an emergency. So eligibility, I talked about this a little earlier. You can receive Social Security at age 62 if you retire. For an example, my son just retired from the military. Yeah, I know, I'm still working and my kid's retired. He's 40. He's retired from the military. He's getting military benefits, but he cannot get Social Security. He cannot get Social Security. Now, if he qualifies for Social Security, he can only get it once he turns 65. I have a friend whose husband passed away at age 60. When she turned 62 years later, she was able to get his benefits, and get his Social Security benefits, but she could not qualify for Medicare. She could not qualify for Medicare until she turned 65. But there are some exceptions. If you have ALS, a Lou Gehrig's disease, or if you have end-stage renal disease, those are the exceptions to getting the Medicare. If you are permanently disabled and you're getting SSDI, again, you have a 2-year window waiting period before you can get Social Security. Okay, so there are some help available for low-income individuals. There are Medicare savings programs in California. I believe United Health and Blue Cross have Medicare savings programs. Now, the Medicare savings program are state-managed programs that can pay all a part of your original Part A and Part B out-of-pocket expenses, and that includes your premiums and your deductible. But you will need to qualify for that assistance, and that you would have to qualify by making a certain amount of money, and you would have to qualify with assets. You can only have a limited amount of assets. Your Part D is they have the Part D low income subsidy for extra help for prescription. This extra help program help with the cost of your Medicare prescription, including your premiums, your deductibles, and your co-payment. But again, you would have to qualify for this, and you would have to qualify with limited income and with limited assets. And they also have prescription assistance programs available as well. Now, as far as getting Medicare services, the only way that you can get Medicare services is you have to see a Medicare certified provider. And these Medicare service providers are approved. They have to be approved. Their facilities have to be inspected by a state government agency. So if you go into a doctor that's not approved to accept Medicare, don't look for Medicare to make that payment. And also, if you want Medicare to pay for something, if you have Medicare Advantage, you must get that service in-house, in-network, unless it is an emergency. If it is an emergency, there is a waiver for that. When it comes to protecting your Medicare account, like I said, there are a lot of scams going on that are that are ripping off the Medicare fund. And if they continue to rip off the Medicare fund at the rate that they are going, we may not have this program for much longer. So what are some of the things that you can do? If someone call you on the phone and say, I need your Medicare number, some personal information, you never give your Medicare or your personal information out over the phone. If you think the Social Security is calling you or someone is calling you, say, let me take your number and let me call you back. Never reveal your number to anyone, even your trusted providers. My daughters don't know my Medicare number. They don't know my Social Security number because I don't trust them. So when in doubt, you verify. You verify. And another thing you need to do once you receive Medicare, you will receive a statement. Once you receive Medicare and you go in to get service, you will receive a statement in the mail. And that statement will tell you the name of the doctor, the date that you went to see the doctor, and the cost related to your visit. You need to go over that statement with a fine-tooth comb to make sure that you are not being billed for something, a service that you didn't receive. Again, why is this important? Durable equipment. That's the biggest scam out there. They will call you and they say, do you need a knee brace? Do you need a cane? We got this hairy cane, all of these different things that you may not need right then. They'll take your Medicare number and they will bill Medicare for these services. Then when you get to a point that you need these services, you can't get them for some time. Why? Because Medicare has already paid for that. So it's very important that whenever someone calls you and offers you medical services over the phone or by email, that you deny that. Go to your doctor. If you need any type of services, get it from your primary doctor. And when you're signing up for these services, especially if you're getting Medicare for the first time, you want to do a research on the Medicare Advantage or the whatever program that you want to use or whatever doctor's facility that you're going to use. You want to make sure that you do your research. Look to see if there's any complaints about that doctor. Look to see if Medicare has fined this doctor. Or anything before you go there and give up your information, and be sure to report fraud. So if you need assistance and resources, you can get help, you can get support, you can get guidance, you can get relief from Medicare.gov. You can download a Medicare and you booklet. It probably want to wait a couple of months before you do that because you want the you want the 2021 updates in the book as well. You can go to your state healthcare for assistance programs. You can go to MedicareResources.gov. Money Talk News is a good source. You can go to Consumer Action's website, www.consumer-action.org, and just type in a search bar Medicare, and all of the resources that we have about Medicare will pop up, and you can just take your time and go through it. There is another site that I like. It's called Medicare Interactive. They have a great fact sheet on how you can compare the Medicare star rating systems. And again, that Medicare star rating system is very important because if you are new to Medicare and you're looking to get in a plan, you want to use that star rating system to help you make an informed decision about what plan you would like to get into. So that's it. I hope it was clear. Yeah, are there any questions?
Yeah, it looks like Miriam had a couple of questions in regards to Medicare parts. So if I'm not mistaken, Linda, so not all the parts are required. So she wanted to know, is Part C required?
Sorry, is Part D required?
Part C.
No, Part C is not required. Let me go back. Sorry, go back. You have Part A, which is your hospital insurance, and Part B, which is your medical insurance. If you get original Medicare, you're going to have Part A and you're going to have Part B, okay? But again, original Medicare does not cover, it covers a lot, but does not cover everything. So therefore, in addition to you paying a premium for Part B, you still will have co-insurance and deductibles for your Part B. You're still going to have co-insurance and deductibles for your Part A. But in order to close up the gap for individuals, a lot of people go to Medicare Advantage. And the reason they go to Medicare Advantage is because, again, they pay less money than they would pay if they get their Part A and Part B. So if you have Part A, Part B, you would have to have a standalone Part D prescription drug plan that's going to cost you additional money. Your Part C, if you go to Medicare Advantage, most of those plans come with the drug plan. You will have, yes, you will still have to pay your Part B. You will have some deductibles and co-insurance, but it will be a lot less than it will be for Part A, for Part B. The best example that I could give you was individuals with end-stage renal disease. If they stay with Part A and Part B, they will end up paying like $17,000 for their treatment. But now that they can go to Medicare Advantage, they'll pay like, I think it was like $7,000 or so. So it's a really, really big difference. So you pay less. The other way that you can bridge the gap, you can keep Part A and Part B, but you get what's called Medigap. Medigap is just what it says. It's insurance that you buy out there on the market, and that insurance covered the cost of some of your co-insurance, some of your deductibles. So you pay, let's say you pay $100 a month for this insurance. I'm not saying that's what it is, but let's say you pay $100 a month for this insurance. So then when it comes time for you to pay a deductible or co-insurance, you don't have to pay it because your Medigap insurance is going to come in and pick up the tab. Make sense?
Yeah, and I just kind of wanted to expand a little upon between regular Medicare and Medicare Advantage. Now, with Medicare Advantage, do you have, let's say, for example, do you get to choose your own providers?
Yes.
Yeah, you do? Okay.
Yeah. You go with the plans in the state. Remember, I said there are so many plans in California. You could have
Kaiser, Blue Shield,
Blue Shield,
Anthem.
United Health. They all offer HMO. They offer HMOs, Medicare Advantage, and PPO, a Medicare Advantage. It's just whatever that's going to work best for you and what's available in your area.
Gotcha. And this is also from Miriam too. She had a question regarding ambulance fees. Does Part B cover all ambulance fees, or would she need to get like a supplemental policy?
Remember, Medicare only covers 80%. So the 20% you would have to pay out of pocket.
Okay.
And I tell you, my mom was 95 when she passed away. And she was, the last 6 months of her life, she was falling and in the house living alone. And we had to call an ambulance service to come and get her. And they send those bills in fast, way before Medicare even thinks about paying for that bill. And they pile up, and then next thing you know, they're trying to go to a collection agency. So that's one of the things you want to be stay on top of if you use ambulance service, and just go ahead and pay your 20%. But you will get something in the mail from Medicare, and they will tell you what your part is. You look for that, what your part is that you owe. Because remember that credit reporting agencies have came to a mutual agreement that any bill related to medical will not go on your credit report until like 120 days after you incurred that service. So they give you enough time to deal with the company and to deal with Medicare or your plan to get that service taken care of before it ends up on your credit report.
Julie asked, would Advantage only cover the 20%? I'm assuming this is for, are you talking about the ambulance fees, Julie? She's talking about the ambulance fees, the 20%. Would Advantage cover it?
More than likely, I would have to look that up, but more than likely your Medicare Advantage is going to cover it. But generally, if you are, unless you are down the street from your facility, you're not going to go to, for an example, I live close to Kaiser, but there's another emergency services that's closer to me than Kaiser. So more than likely, they're going to take me to that program. So Medicare will pay for the ambulance services. As far as Medicare Advantage, I would have to look that up, and Deborah, I will email that to you.
Okay. Oh, and Miriam posted the City of Monterey Park has a program. You can sign up and add $50 a year to pay for additional $50 a year to pay for the additional costs not covered by insurance. That's not a bad deal.
No, it's not. What's the name of the program?
I'm not sure. It's the first time I've heard of it. Do you know the name of the program, Miriam? And it's just through the City of Monterey Park, it looks like.
Is it for employees or anyone that live in the city?
It sounds like it's probably an city employee program.
Oh.
Well, it's just another. No, it's for people living in the city. Oh, really? Interesting. Well, you know, if you could find out the name of that program, Miriam, that'd be great. You can just shoot me an email, which I can put in the chat, because I'm curious. I'd like to share that also with our partners.
Yeah, please. I would love to know that information.
Yeah. And the other question, last question that we had was, where should folks start? Because since they're being inundated with all of these mailers, do they contact all the insurance companies and talk to them, or is there like a good place to start?
I would start on the Medicare.gov website. That's where I would start. I would start on the Medicare.gov website. I would go to the Medicare.gov website, and I would look at the at some of the information that they have. They have a ton of information about Medicare. As far as the Medicare Advantage, I will go to the, Deborah, I will send you the link to these websites. I will go to the state of California and get a list of the Medicare Advantage plans that they have in California. Oh, no, you don't have to do that. You can go to you can go to that rating program that I told you about earlier. There is, you can Google, I'll send you the link to it, but you can Google Medicare Interactive, and put in how to compare plans using the Medicare Star program. The whole point of the Medicare Star rating system is for you to take a look at the different plans. Remember, they rate plans on how they manage. They rate the plans on how they manage chronic long-term illness, how the plans is responsiveness and care, and they also look at member complaints, any problems members are having getting services, and also for health plan customer service. That's for the Medicare Advantage, and they also have a 5-star rating plan for the Medicare Part D prescription, and they look at them in 4 different categories. They look at the drug plan customer service. They also look at member complaints. They look at members' experience with the drug plans, and they also look at drug pricing and patient safety. So if you can go to the star rating. You can find it. You can find the star rating by using the Medicare Plan Finders tool that's on the Medicare website, or you can call 1-800-Medicare, 1-800-Medicare. Now, the new plan rating will come out October. So, but this October, they're going to use the rating for last year. Remember, I told you they are going to change their rating system. But the best way to look at your Medicare Advantage and your prescription drug plan is to go to that 5-star rating. Again, you can use the Medicare Plan Finders tool that's on the website, or you can call 800-Medicare and get connected to that site. Does that make sense?
That makes sense to me. And just a stupid question. So when folks are ready to apply for Medicare, they just go to Medicare.gov?
Say that again?
And when folks are ready to apply for the program, do they just go to Medicare.gov?
Yeah, go to, go to Medicare.gov. Read everything you can and learn everything you can about Medicare and the Medicare program. That's the most important thing, to learn everything that you can about the program. Then you need to decide if you're going to get if you're going to take Part A, Part B, and Medigap. And you want to do your research. Medigap insurance are going to be offered by the state of California. They're going to be, so you can go to the state of California Insurance Exchange and find out about Medigap. But those companies will have to sell insurance in California.
Mm-hmm.
Okay. Now you want to look at the Medicare plans and prescription plans, and you want to find out which one is best for you. I said go to the Medicare star rating system. They're going to rate the plans, and they're going to tell you what the plans offer, and then they're going to rate the plans. But just keep in mind, a program with a 5-star rating, it's enough to make you to make a good informed decision. But remember, there's a problem with the rating system, and that's the reason Medicare is changing it, and they're not going to change it to 2023. So, but it's the best information out there that's available now to help you make an informed decision. So go to the Medicare website. Learn, download. There's a book called Medicare and Me. That's where I started. I started with Medicare and Me. I read that book inside and out. If I had questions, I went to individuals with questions. The best thing is to start early. Start early doing your research. If you're gonna stay with the original Medicare Part A and Part B, remember you're gonna have to have a standalone drug plan. Then your other decision is, if I stay with Part A and Part B, do I want Medigap? And the whole purpose of Medigap is to it's extra insurance that you're going to buy from a private insurance company that's going to pay for healthcare costs that's not covered by your original Medicare A and B, such as your co-payments, your deductible, and your cost of healthcare if you travel outside the United States. So if you're going to stay with A and B, oh, cool. You need to also get a standalone Part D program. If you don't want Medicare Advantage and you want Medicare Part A and B, then you want to look at Medigap. You want to look at supplemental private insurance that's going to help cover some of those costs. Or you're going to go to Medicare Advantage. If you're going to go to Medicare Advantage, then you want to use that 5-star rating system to help you compare and contrast the different plans, and also for the prescription drug plans.
So hopefully that answered your question, Miriam, because I know you're getting a little overwhelmed because you said that you're helping your mom research to apply for Medicare. So I think because she kind of wanted to know where to start and what she should be looking for. So pretty much what it is, find out what your mom needs and what she feels comfortable with, correct?
Okay. Well, just remember there are at least 25 Part D plans in California. So that's a lot to compare and contrast, but take your time. Take your time. And if you can. And again, if you have any questions, you can email me at Linda, Linda, .Williams, WILLIAMS, at consumer-action.org. If I cannot answer that question, I will get you to the expert that I work with. Her name is Miki Nozaki. And like I said, Medicare is her second language.
Wow. All right. Well, thank you so much, everyone, for coming today. Thank you so much, Linda, for your presentation today. Like I said, this recording is going to be uploaded to the City of Monterey Park's YouTube channel, and it'll also be made available through the library's website. I did want to let you know that we do have an online consumer health resource center with a special tab on insurance. And I'm going to be adding a lot of the resources that Linda recommended today to our consumer health online resource center, just so it's easy. It's all in one place, it's easy to access. So,
and you can go to our website, www.consumer-action.org. You can download our Medicare, our insurance module, which includes Medicare, and all of the assistance and resources are included in the PowerPoint slides. You can download it and print it. And remember, there are California senior care agencies available that you can call. There are counselors that will walk you through everything that you need to know about Medicare. And I will send Deborah a link and the phone number to that as well. You can call them and they will walk you through everything that you need to know about Medicare. You got Medicare and you got MedicareResources.org, you got BoomerBenefits.com. They offer services from A to Z covering Medicare. So there are a lot of resources out there, but there is the Medicare, I think they call it Senior Patrol in California. They have great counselors that can walk you through anything you need to know.
Alrighty, well, thank you so much, everyone. Have a great rest of the day, and definitely check our website every now and then for more informational sessions. We actually do have this same presentation being offered in Spanish this coming Saturday, and we'll be working with Consumer Action throughout the year for more events. So thank you so much and have a great day.
Thank you, and I hope you got something out of the webinar.
All right, thank you so much, Linda.
All right.
Have yourself a great day. Enjoy your granddaughter's birthday party.
I will, thank you.
Okay, take care.